Growth hormones are being administered to young children in an effort to enhance the growth patterns of those who are expected to be shorter than average. As a mother of a shorter than average son, I can relate to the pros and cons of human growth hormones, HGH. My son has remained below average on the growth charts for his height, but I believe that HGH have more bad qualities than good. It is important to understand what human growth hormones are, the uses and abuses of this hormone, and the side effects that follow usage. We should not only care about our own health and well-being, we should also care about the health and well-being of our children. We know the importance of making sure that everything our children consume has a positive and non-detrimental effect. It is my intent to educate and persuade you not to use HGH for children. We all need to know more about this topic in order to be the voice for children everywhere. First, I would like to begin by defining what growth hormones are. According to Wikipedia, human growth hormones, also known as HGH, are a peptide hormone that stimulates growth, cell reproduction, and cell regeneration in humans and other animals. HGH, produced by the pituitary gland, spurs growth in children and adolescents. Synthetic human growth hormone was developed in 1985 and approved by the FDA for specific uses in children. Naturally, some people have lower levels of HGH than others, but that does not necessarily mean you're a candidate for HGH. HGH is a natural occurring substance in the body on its own. It is a substance in your body from birth, and it is at its highest level of production during your adolescence years. You will have the most of HGH in your body between 12 and 25, and then it comes crashing down at a rate of about 14% every 10 years. There are 3 forms of HGH, and that is with injection, pill form, and a spray. The craziest part about the spray is that the majority of the base is water. Going back to the homeopathic HGH, it has been shown that it isn't a very effective way to receive the human growth hormone benefits according to hgh.us.com. Knowing more about the history of human growth hormones will help you to understand why the cons outweigh the pros. This really is a dangerous drug, especially for children. Knowledge is power. Now let's talk about the uses and abuses of HGH. In children, HGH injections are approved for testing short stature of unknown causes as well as poor growth due to a number of medical causes including HGH deficiency, Prader-Willi syndrome, an uncommon genetic disorder causing poor muscle tone, low levels of sex hormones, and a constant feeling of hunger, chronic kidney insufficiency, children born small for gestational age, Turner syndrome, a genetic disorder that affects a girl's development. Growth hormones are used in abusive ways as well. The most common use for HGH are not FDA approved. Some people use the hormone along with other performance-enhancing drugs such as anabolic steroids in an attempt to build muscle and improve athletic performance even for our young children of athletes. Nevertheless, some people obtain injectable HGH from doctors who prescribe it for off-label purposes, which is not approved by the FDA, and through internet pharmacies, anti-aging clinics, and websites. Others purchase HGH through the pill and spray form. The majority of HGH products don't even have that HGH ingredients, and that's what's so scary. Last, are you ready to hear the side effects and other hazards that come with growth hormones? Here are just a few. Swelling due to fluid in the body's tissue, which is edema, nerve muscle, or joint pain, carpal tunnel syndrome, numbness and tingling of the skin, high cholesterol levels, cancerous. HGH can also increase the risk of diabetes and contribute to the growth of cancerous tumors. That's right, I said cancer, tumors. Furthermore, if you get the drug illicitly, you may not know what you are really getting. Because of the high cost, HGH drugs have been counterfeit. According to Mayo Clinic, leukemia has been reported in a few patients after treatment with growth hormone. These are just a few side effects from growth hormones. In conclusion, knowing more about the history of growth hormones, uses and abuses, and the side effects, we can better guide our children and having knowledge. Before you decide to give your child a growth hormone pill, injection, or spray due to your own personal vanity, think of your child's future. Could this pill potentially set your child up for cancer, diabetes, high cholesterol, or nerve pain? Personally, I would rather have a shorter than average child than a child fighting for cancer or other illnesses. Knowledge is power, people. Understanding more about HGH is key to whether or not the results are ultimately beneficial. Please enjoy the video attached for more details. Thank you.